or a physical examination. So we're going to talk about all three of those: patient assessment, vital signs, assisting with the primary physical examination. First of all, it's very, very important that you realize that you are going to be maybe one of the people that talk to the patient the most. So, with that being said, you need to be able to, be very professional, but also you want to be personable, okay? Especially, and I hate to say especially because it's not just elderly individuals, but, people miss that personable part about the office sometimes when so much is digital. Like, I go to the doctor every month for ADHD, and well, we've been doing telehealth just like we're doing right now on Zoom, but I do have an option every third month if I want to come in. So next month I'm going to actually go into the office because it is still important to see your patients. Vital signs. Y'all, the word vital says it all. Okay? Having the role to actually take vital signs is huge. Okay? If you have a patient that suffers from hypertension, well, hypertension, any kind of bottom number over 90 is, with your blood pressure, is going to qualify you for hypertension. Well, what if you don't hear it and you just put some gibberish down, okay? Well, if you put over 80 or over, 98, then that can make a difference in the type of medicine that they're going to prescribe the patient, okay? So, vital signs are extremely, extremely important. Also, whenever you're doing vital signs, I need you to wear gloves, okay? If there's a sink in the office, or if you're going to be doing vital signs, just because you're medical office administration, you need to make sure that this office part is going step by step the way it's supposed to. Like if you go to the ER, and in the ER, they you think you're getting, the first time I went in a long time, I thought I was getting called back real fast, just like that, because you fill out the little computer thing, and then from the computer thing, then they call you into the triage area and they take your vital signs. Well, just as soon as I sat down, they called me to come back, and I was like, oh, this is gonna be fast. I never got back to a room this fast ever. No, because then I went back out to the waiting room, and then from there I got called back to the back, depending on what I was in the ER for. So those vital signs that they take in triage are determining your overall health and how fast you need to be seen. Okay, not always is it, you're not always the most emergent patient there. Okay, for example, somebody coming in that's in cardiac arrest or is having chest pain, they are going to be seen first. It's the way it goes, because they have less of a window to benefit that patient and take care of that patient compared to your ailment or whatever you're in there for. So, patient assessment is always going to depend on your whoever your patient is. You don't necessarily want to, if it's an elderly individual, you don't want to automatically go up and be like, hi, how are you? Look, just because they're elderly does not mean they can't hear. Talk in a regular tone, and then if they say you're gonna have to speak up, because they're gonna tell you what you're, get on this ear, or I hear better out of this ear. All right, so whenever you're talking to a patient, get on their eye level. This is huge in pediatrics. If you're dealing in pediatrics, which I could never do pediatrics, I like well kids, not sick kids. So, you're not going to talk to them necessarily like they're an adult, but you don't want to take a teenager, which is considered a pediatric patient, and be like, how are you today? You today? Okay, you don't want to do that either. So, you know, get acquainted with age groups. And, you know, I've never been in the cool crowd, but, okay, you know how to talk to a kid without maybe going overboard with it, okay? Always talk to the patient. If it's an elderly patient and there's an aide in the room, don't talk to the aide first. Talk to the patient. You're here to see the patient, okay? That they're here to see you. So don't always assume that the aide is there because they are unable to do anything at all, okay? Let's see. You want to make sure that you're asking open-ended questions that need to be open-ended. Okay? An open-ended question is a question that requires more than yes, no, this, or just one-worded answers. Okay? What were you doing whenever this started? That's usually going to be a sentence. I was mowing the yard when my chest started hurting. Okay? And then some questions aren't always open-ended, but they're important. Like, how long had you been mowing? Okay? That might be a one-word answer, but it's pertinent to, oh, I was out there for 5 minutes compared to, oh, I think I started around 8 a.m. and, yeah, this started around like 4. Okay, did you stop for lunch? Did you, you know, so you're going to go from there. And this is really hard to just pinpoint because there's going to be different, lots of different patients that require different direction with your questioning, okay? Let's talk about vital signs, okay? Your true vital signs are blood pressure, heart rate, or pulse, respirations, okay? And there's going to be some more that you will take with these. They just aren't necessarily what you would call true vital signs. Height, weight, usually taken on the same scale or same machine. And then you have temp. All right. Woo. All right, blood pressure, heart rate, pulse, respirations, height, and weight. Now with pediatrics have a whole new qualification or group for themselves. They are going to have a higher heart rate, higher blood pressure, things of that nature. So these we're going to talk about today are going to be adult vital signs. Now, blood pressure is something that you're not going to take depending on a time, okay? So when it's not a time thing, you're doing it yourself, which I'm going to break down blood pressure. Now, heart rate and respirations. This is the part that I'm telling you is having to deal with the temperature, the time of which you're going to take these things. So, these two right here are going to be in a certain time limit. Okay? Height and weight, those are usually done not necessarily in the same office room. So, when we talk about, like when it comes to your assignment, and it's asking you how Billy Joe, or whatever his name is, can be better at questioning and taking patient interview questions. Sometimes you have to separate a patient from a family member, okay? This is not in all cases, but it's important to know that not everybody is portraying the image that they are putting out, okay? So if you notice a patient that keeps looking at their other spouse, partner, whoever they're with, and waiting for them to answer, or maybe they try to answer for them, it would probably be a good idea to separate those two individuals, because that person is kind of telling that person what to say. And obviously that person's not going to talk in front of that person honestly. But don't assume that. This is why a lot of times in the doctor's offices, you'll have the pamphlets for spousal abuse, or either female or male, pamphlets in the bathroom, because nobody's going to usually go into the bathroom with you. Okay? Stand by. It's so pretty outside, y'all. Or Miss Scott. I've decided to have class outside because it's too pretty to be inside. So I'm socially distancing.
Yes,
I am socially distancing from my office. I had to get out here. It took me a good hour to set it up, but I feel like I'm in a new realm, and I highly recommend that you and everybody do the same. Don't let that couch grab a hold to you. Gluteus maximus and not let go. You sit down,
okay.
And I'll look down and it's 3 o'clock and I'm like, did I eat lunch?
Yep.
Alright. So, let's do blood pressure first. If y'all see some wild animal run by out here, it's just my family's. Now, if you see me jump up and run off, it's because it's a bear or a cougar or jaguar or something. I'll run from a rooster. Okay? Don't put it past me. Alright. Blood pressure, also abbreviated as BP. Okay? I'm going to show you this after I put it on here. I'm going to have to rig up something a little bit better for my outside office. It's a corner office, panoramic view. So when you take a blood pressure, you're going to see something that looks kind of like this. You'll see, usually they'll tell you the normal is 120 over 80. I think it's the mailman. Anyway, blood pressure is 120 over 80. They're going to tell you that's the norm. This number right here, you don't want it to really go above 80. Okay? Any number above 80 qualifies as pre-hypertension. Okay? Pre-hypertension. Now, if this number is 90 or higher, that is hypertension. Okay? So, I think that this number right here, 70, is more norm than not. Okay? You want to keep it low. Now, this top number is called the systolic number. That's because the word systole means beat. Okay? So, when you're taking a blood pressure, this top number is going to be the first beat you hear. Okay?
I didn't look at you really good while ago.
Alright, now, this bottom number is the diastolic. Okay, this number right here is what your heart should be at rest. So, if you're resting and chilling out, you shouldn't be like, or your heart shouldn't have to be pumping really hard to get your blood to circulate through the rest of your body. Okay? Now, I'm going to show you something really cool real fast. If the word systole means beat, like the next time that you're in the car with someone and your favorite song comes on, you can say, turn it up, that's my systole. But then, I mean, they're going to call you a nerd and all, but because that's y'all beat. Alright, I know y'all have seen these, especially if you've talked about EKGs. This one single thing right here is one beat. Okay? So, if you're coming across something like this, just a flat line, which is what people will say, oh, the patient's in flat line. Well, that's not the medical term for flat line. The medical term for flat line, okay, is it's lacking a beat, right? If I put an A or an AN in front of a word, it means lack of, without, or none. This has no beat. Okay? So the real actual term for flatline is asystole. Okay? So next time you're watching a medical show or a movie and it comes across there and they're like, patients in flatline, you could be all smart about it and be like, well, why don't they just call it by its real name, asystole? Okay? Because it's without a beat. Now, the reason we don't use an N right here is because this is not a vowel. Okay? Anytime you see this in a word, P-N-E-A, that's when they're going to be talking about breathing. Okay? You could put an A in front of it and it'd be like sleep apnea. Well, it's lack of, without, or none breathing. Well, it's going to be periods of without breathing during sleep. That's why they usually put sleep in front of it. I'm trying to think of one. I'm sure I'll think of one here in a second where I'm going to have to put a oh, here we go. Got it. Anytime you see this, emia, you should think blood. Okay? So if somebody suffers from very, very thin blood, that would be lack of, without, or none. You wouldn't put an A only because this is a vowel. So you would put anemia, which is thin blood. These are people that have low iron and usually like to eat a lot of crushed ice. Okay? Now, when you take a blood pressure and you're taking it on with a blood pressure cuff, you're taking it manually. First of all, we need to know that the stethoscope is the thing that goes in your ears. Okay? And then you have what you call the blood pressure cuff. But that's not what it's called. Okay? The blood pressure cuff is actually called a sphygmomanometer. Yep. And now you know why we call it a blood pressure cuff. Now, I'm fixing to break this down for you to show you how to say it, okay? Because that is like crazy looking weird. Now, I'm gonna like break it on down. The snake says fig like the fruit. Mow like your yard. Man, like the man is mowing your yard. Now this one's a little tricky. All right, this chick right here, she is a famous singer. So when you say fig mo man, it's not oh, okay? It's ah, like you're singing, like you're a famous singer. Ah, look, I forgot to put the rest of her hair on here. All right, now that looks better anyway to me. Oh yeah, I'll get carried away. Anyway, now you got to get real redneck and southern, okay, for the ending of this part. So we got fig, mo, man, ah. Now, because this is a famous singer, and you're from the sticks like me, you want to meter. Okay? Maybe I need one of these things right there. Meter. Okay? So, fig, mo, man, ah, meter. Anyway, that's what we call a blood pressure cuff. Okay? You need to know what your equipment is and all the name of your equipment, because if you don't, it's going to make you look like you don't know what you're doing because you really aren't. Alright. So, when you wrap that blood pressure cuff around the patient, you're going to do it on the arm right here. Okay? You want them to sit down. You don't want them talking a lot. You don't want them to cross their legs. Okay? Yeah, there are some situations where you don't want to take a blood pressure in a certain arm. Like if they've had a mastectomy, where they've had a breast removed, usually you're going to take it in the other arm. This is why it's important to know about your patient. Look at your patient's chart. Know what they're usually like. This all comes in with that patient assessment part and while you're taking vital signs. Okay? So when you put that blood pressure cuff around the arm right here, you're going to put the bell of the stethoscope right here. Okay? And then you're going to put the stethoscope in your ear. Now there's a meter that is on the blood pressure cuff that comes off of it, and then there's going to be I should have brought one out here.
Mommy, brought this.
And then there's a bulb that you're going to use to pump it up. Okay? Let me minimize this and show you what I'm talking about, because it's important. Let's see, which one of these? This one looks good. Alright, I'm gonna share my screen. Can y'all see that meter?
Yes.
Awesomeness. Now, this is one quick way to look like you don't know what you're doing too. This meter, it has all even numbers. Now, if you're taking an electronic, like a machine blood pressure, you're going to write down exactly what that machine tells you the blood pressure is. But if you're taking it yourself manually, this is what you're looking at. Okay, so you're getting the numbers yourself. So once you get that cuff on and you start to pump that bulb, what's going to happen is this meter is going to start to, this needle is going to start to go up. Now, looking at the patient's chart, if they suffer from hypertension, I might go to 200, 190, okay? The important part is to go past the first beat, because that's your top number. So, when you pump it up and you go to 200, that's when you're going to easily let the air out of that cuff. And that needle's going to start to drop. You shouldn't hear anything at first. Now, the needle might jump like that, but it's the top number of your blood pressure is not when the needle jumps, it's when you hear the first beat. So, now if you're watching it and it's going like this and you still ain't hearing a beat, then you need to readjust your stethoscope, okay? But